Joining us now from Amman is Jonathan Fowler, the spokesperson for the UN's Agency for Palestinian Refugees. Very good to have you on the program. So what is UNRWA doing now to help these people living in these very, very dire conditions?
Well, thank you very much for having me on the program. Indeed, our teams on the ground are working flat out to, for example, try to pump away wastewater or raw sewage to actually try to improve the living conditions of displaced people. It's, of course, immensely difficult because we've had these storms, these heavy rains coming over and over and over. Basically creating floodwater. That's a huge problem for human health, but also for dignified living conditions. And the situation is quite catastrophic. But our teams continue to work on the ground relentlessly to try to improve things. It's just extremely difficult to do it, given the inadequate flow of humanitarian aid into the Gaza Strip because of the restrictions imposed by Israeli authorities.
So do you have enough equipment to deal with this flooding?
Absolutely not, unfortunately. And this is a problem. I mean, this is managed scarcity. If enough equipment were allowed in, and in fact, I mean, UNRWA, my agency, we have been banned from bringing anything in by the Israeli authorities since March. I mean, this is completely unacceptable given the scale of the humanitarian crisis. We've got tens of thousands of people who've been killed. Close to 200,000 people injured, hundreds of thousands of displaced people living in flimsy tents that have been destroyed by rain. It's just, I mean, this has to end. Supposedly the ceasefire is in place. The humanitarian operation has not been permitted to scale up at the level required.
Jonathan, what are some of the stories that you're hearing from people who are living in these conditions?
I mean, everything we hear underscores the absolute level of desperation. You've got families who've been forced to move multiple times. They were forced to move during the fighting, during the conflict itself, the war. But then, they find themselves in this situation of the ceasefire situation where, I mean, one could argue, well, anything is better than what went before. And then they're getting absolutely battered by this weather. And people, of course, I mean, the temperatures have fallen in tandem with the rainstorms. So people are freezing to death. And I mean, this is shocking. We hear this from families all the time that our colleagues work with and are trying to support. And indeed, I mean, our own colleagues, all our colleagues on the ground are Palestinian. They're in the same situation of displacement, and they're still trying to work. But over and over and over, I mean, everything we hear, it's just the continuing horror of this humanitarian crisis is unbearable.
What do you think is the biggest danger right now?
I mean, there's multiple layers of danger. I referred to people dying of cold. So, I mean, the danger of exposure, the fact that people are living in, I mean, what remains of flimsy tents, and huge numbers of tents, of course, have been destroyed or heavily damaged. And these are also not new tents. I mean, these are tents which came in, for example, during the period when humanitarian aid was allowed during the first ceasefire. They're sort of flimsy scraps of plastic. People have sort of, it's almost like you do-it-yourself creation of shelter. These things are not holding up. People are living in ruins which have collapsed because of the rain, because these were ruins which were left over from bombardment and other destruction during the war. But it's just, I mean, there's the shelter problem, but then there's the health problem on top. And you referred to this, of course, in your introduction. But the fact that we're seeing increasing rates of disease, the fact that diarrheal diseases, waterborne diseases, but other diseases caused by proximity, respiratory diseases, all of these kind of things coming together at a time where the medical system is not able to function well. I mean, we're seeing tens of thousands of patients in our remaining clinics every day, and yet it's not sufficient because we don't have an adequate medical supply. On top of that, I mean, what's missing is there's stockouts of fuel, and fuel is necessary to be able to operate pumping systems and vehicles in order to be able to do a proper humanitarian operation. So everywhere we look, there are problems, and yet we're continuing to try to do what we're meant to do.
All right, Jonathan Fowler from UNRWA, thank you so much for your time.